Hi everyone, I'm Ed Hyland. This is the Big Ideas Theater at AARC Congress. I'm joined now by Constance Mussa, who is with Rush University, a professor there, assistant professor. Welcome.
Thank you.
Talking about tracheostomy management, controversies in tracheostomy management. Why is this becoming a subject again?
Well, because although their tracheostomy patients are few relative compared to other patients, they consume a lot of resources. And there are several studies that have been done, for example, one from the United Kingdom called the NICE study, where they're looking at the outcomes. It's called the confidential summary of outcomes and death in tracheostomy patients, and they realized that tracheostomy patients have a lot of poor outcomes compared to other patients. And so they had this resurgence of interest in making sure that tracheostomy patients are managed using, in a safe manner, using the best available evidence.
Now, what's your current involvement?
Well, right now I am currently working on an clinical practice guideline for the American Association of Respiratory Care. We're looking at, we're conducting a systematic review of the literature to see whether or not we can have the evidence-based practice guidelines for these respiratory therapists so that they can provide a more safe and effective care for these patients.
Can you give us some idea of the parameters as far as time? I don't know, because sometimes studies can take quite some time to get the guidelines together and get it just the way you want. Do you have a window for that? Yes,
I think at least by the end of 2019, we're hoping to get the guidelines at least started. The systematic review should be finished in the early part of 2019 so that we can get the guidelines out for respiratory therapists to use.
Good. So before next Congress, we should be with the guidelines and get them under discussion. Now, have you gone through the solicitation for feedback, or I'm trying to figure out the guidelines process?
Well, we actually conducted a survey. We were in the process of conducting a survey of respiratory therapists in the United States to see their practice in tracheostomy management. And we did get quite a few surveys back, and we're probably in the process of looking at the survey and analyzing the data to see if we can compare the pre-data versus after we put the guidelines out to see if there's any change in practice.
So the membership actually has a hand in putting these guidelines together then?
Absolutely, absolutely.
Talk a little bit about kind of where you see all of this going, as well as what you would like to see happen in the next, say, 6 to 12 months.
Well, I think we're working with a group of very dedicated and passionate respiratory therapists from all over the country. And so we're looking at all the different evidence to see if we can come up with something that will enable respiratory therapists to truly provide the most effective care for patients. So although we have looked at the evidence, and the research for tracheostomy patients is very sparse. And so maybe we're going to try to get respiratory therapists themselves to get involved in research. I think that might be something that, long term, that could happen. But within the next 6 months, we hope to get the team together and get these guidelines out.
So is that the key message you'd like RTs to take away? Start taking notes, providing that information, perhaps?
Yes, and also looking at where they're practicing to see what gaps there are, and to probably join with the Global Tracheostomy Collaborative, which is a platform that has engaged respiratory therapists, physicians, nurses, nationwide and also globally to get the best care for tracheostomy patients. So if they can submit data to get benchmarks out there, then that might enable care to be much better.
The best participation are the folks who are actually doing it, right?
Yes, because they're at the bedside, and so whatever they see at the bedside, it can inform future research.
Fantastic. Constance Mussa, thank you so much for coming by and joining us.
Oh, you're quite welcome. Thank you very much.
This is the Big Ideas Theater. Thanks for joining us.